Scientists are predicting that by April 2021, more than 100,000 people in Uganda will be infected with COVID-19. This comes as the country today registered 702 new cases, bringing the cumulative number of cases to 27,071. So far, 220 of these people have died. Dr. Rhoda Wanyenze, the Dean of Makerere University School of Public Health and a member of the Scientific Advisory Committee on COVID-19, says these numbers are just an estimate. She adds that as community infections rise, so will the number of deaths.
When you are testing people largely based on those who have symptoms, and they are calling to say, I have fever, I have cough, I have flu, then you're picking the tip of the iceberg. That's about the 20% that he's talking about, because the majority don't have symptoms and they will not call to say that they have disease.
About 700,000 tests have so far been conducted. According to Professor Pontiano Kalebu, the Executive Director of Uganda Virus Research Institute, this is a small portion of the country's population. A community surveillance survey currently being carried out in Chamulibwa and Lukaya town councils in Masaka district has so far revealed a positivity rate of 7%.
Yeah, we wish to talk about it, that if we don't have the measures, prevention measures, masks, distancing and all that, it's likely you will not be spared. Will not be spared. So we anticipated that we could come to this level. Yeah. Of course,
Dr. Misaki Wayengera, the chairperson of the Scientific Advisory Committee on COVID-19, says Uganda is going to institute further restrictions to curb the rising positive cases.
So the worst scenario is to have very sick people who need hospitals, but we don't have where to put them. So the magnitude of the restriction measures will depend on how dire the situation is. So it might not be a total lockdown, because a total lockdown is not sustainable to our setting.
This week, when the country registered over 1,000 positive cases in one day, Uganda became the third worst country on the continent after Morocco and South Africa in managing the rise in infections. Scientists say vigilance should not be relaxed because vaccine trials have been successful in Europe and North America.
A vaccine is just one of the tools we would need for prevention. A vaccine will not replace a mask. The estimate is we might get these vaccines down maybe by about May, June, but we have to live to get to the vaccine.
Those in the habit of traveling to the villages for the Christmas holiday have been advised against traveling to prevent infecting those in the rural areas who most likely are living with non-communicable diseases. Gillian Nantume, NTV Weekend Edition.